But first, tonight, as the coronavirus death toll rises in Central Florida, a local medical examiner reveals what he's seeing as the pandemic sweeps through our local communities. This is News 6 at 11. I'm Matt Austin.
And I'm Lisa Bell. He is tasked with confirming when people die from COVID-19 or something else, as the state reports another 247 more deaths from the virus, nearly 40 of those happening in Central Florida. News 6 reporter Eric Sandoval pulled all of the coronavirus death records. He's live in Orange County tonight with what he's learned. Eric?
Yeah, Lisa, we pulled all of these reports after some people on social media started questioning the validity of the numbers that the Florida Department of Health was pushing out each day. Specifically, which deaths are labeled coronavirus related and which deaths are not. We poured over hundreds of pages, and tonight we came to the medical examiner for his take.
These cases are all natural cases, for the most part.
Dr. Joshua Stephanie is the chief medical examiner for Orange and Osceola counties. He says his team has investigated more than 300 of the nearly 7,600 coronavirus-related deaths in the state of Florida. He says for a death to qualify, the person needs to have tested positive for COVID-19. They need to have had a CT scan showing inflamed lungs, and they also need to exhibit at least some symptoms before death.
You have to have, the shortness of breath, the fever, the cough, things like that.
We pulled the investigative findings of more than 1,000 coronavirus deaths from medical examiners across Central Florida. We saw many people died of pneumonia. Many were intubated. Some lived just hours after being admitted to the hospital. But Stephanie says his team did have to take a second look at some of the cases.
We did have a motorcycle accident. The person died from their trauma. They just happened to have COVID. We did not attribute COVID to the cause of death in that case because it didn't contribute to that case. I mean, clearly, that person died with COVID and not of COVID.
And there was more.
We had another traffic accident, motorcycle accident, where the person had that accident, was subsequently hospitalized for a long period of time, got pneumonia. That pneumonia happened to be COVID pneumonia, and they died. And so in that case, we did contribute COVID pneumonia.
How do you verify that somebody really died of COVID-19 and not something else?
One, they have to test positive for COVID-19, and we sometimes have to track down those tests because we can't always find the results. And two, they have to have the symptoms and the findings.
Now, those findings that he was talking about often include pneumonia. Now, an important note, Stephanie's office here usually doesn't sign off on cases that include flu-like symptoms. But he says under the governor's order, his staff is ordered to do that, even though these COVID deaths do have flu-like symptoms. We are live in Orange County tonight. Eric Sandoval getting results. News 6, back to you.
Eric, thank you.